What can I start doing now to have a healthy pregnancy?
So preparation for pregnancy is really important. Almost half of pregnancies in the United States are unplanned, and data and studies have shown that unplanned pregnancies definitely have poorer outcomes than planned pregnancies. So ideally, you want to get in to see your OBGYN provider, have an established provider for one, and see them annually so that you can discuss any issues that you may be having. In general, you want to be eating a healthy diet, exercising, be of a healthy weight. If you have any medications that you're taking, you want to review those with your physician to make sure that they're safe for pregnancy. And then really that anyone is a childbearing age or considering pregnancy should be on a prenatal vitamin.
Is it important for me to see a GYN regularly?
So with the annual GYN visit, there's multiple things that are addressed at your visit. Routine screening, breast and pelvic exams to make sure you don't have any abnormalities there. Annual STD screening is offered, which can definitely impact your ability to get pregnant or can affect a future pregnancy. In addition to pap smear screening, which is screening for cervical cancer. They can discuss with you options for preconception genetic testing, in addition to making sure that you're up to date on your vaccinations, and also just reviewing your general health and medications.
How can tobacco, alcohol, or drugs affect my pregnancy or my infant?
Tobacco, alcohol, and illicit drug use can put your baby at increased risk of preterm delivery. Tobacco in particular will put you at increased risk of smaller for gestational size, also have increased risk of miscarriage, and also some defects. Now talking more about alcohol, there's fetal alcohol syndrome, and that's where you can have some potential changes in the face, growth abnormalities, and mental disability and all that. Also just kind of touching on marijuana as well, they've actually noticed that our studies have shown that there's an increase of behavioral problems as well as some attention problems too, and also increased risk of stillbirth. Talking with the other illicit drugs, once again, all of those, it's the meth and that can put you at increased risk of miscarriage, stillbirth, early delivery, increased risk of hypertension or gestational hypertension.
And just to elaborate on that, so no amount of alcohol use in pregnancy is considered safe. The study hasn't shown like you're allowed to have one alcoholic beverage a week or not. I mean, there's no safe amount in pregnancy. And fetal alcohol syndrome is kind of the most severe finding in women that have consumed alcohol in pregnancy, but definitely even without that, there are impacts on both cognitive and behavioral development that are lifelong for the child. And then in reference to tobacco use, something that women often don't think of, pregnancy is a great motivator, and a large amount of women are able to achieve smoking cessation during pregnancy, but then they resume after the baby is born, and that does put the infant at increased risk of things like sudden infant death syndrome or SIDS, asthma, childhood obesity. So even if you're able to achieve smoking cessation during pregnancy, well, that's great. We also want you to continue that habit after delivery as well.
If I do smoke, where can I go to get help to stop?
There is that toll-free number 1-800-QUIT-NOW, that is always available to get some help. I would also talk to your provider, your OBGYN, and other things. We can do counseling and that.
I am wanting to get pregnant soon. I have diabetes and high blood pressure. Will this affect my pregnancy, and how can I manage these to have a healthy pregnancy?
So definitely both of those conditions would put your pregnancy at high risk. Now, depending the impact on your pregnancy would be determined by how well your underlying medical diagnoses are controlled prior to conception, and then how well you're able to manage that during pregnancy. So that plays into why it's so important to get annual care, not only with your OBGYN provider, but if you have other known medical diagnoses, to see your regular family doctor routinely. In regards to diabetes, the key there is glucose control. So if your sugars are really well controlled, the impact to pregnancy is minimized. But if your sugars are not well controlled, it can have huge impacts to the pregnancy. including significantly increasing your risk of miscarriage and birth defects. Ideally, we like for your A1C to be less than 6.5 prior to conception or getting pregnant to minimize those risks. And then beyond those early pregnancy risks, it additionally puts your pregnancy increased risk later on as far as risk of growth issues and just overall fetal well-being. Hypertension, on the other hand, the biggest thing there prior to conception, there are medications that are not considered safe in pregnancy that treat hypertension, so you need to review with your provider to make sure that you are on the safe options for treatment of your hypertension. You additionally want to make sure that your blood pressures are well controlled.
Can having sexually transmitted infections affect my pregnancy or my chance of getting pregnant?
STIs definitely can affect your pregnancy. Some common ones we've heard are chlamydia, gonorrhea, trichomonas, genital herpes, HPV, hepatitis B, HIV. So some things that you'll notice with chlamydia might be like a discharge, and you'll want to get that checked out as soon as possible. Some outcomes on the baby could be an eye infection or pneumonia shortly after birth, so it is important that we treat as soon as possible. Same with gonorrhea, and we can give antibiotics for both of these and treat them quite quickly. Trichomonas, sometimes you won't even have symptoms. Maybe you might feel it might be a little bit discharged, but often nothing at all. And it's also important with all these to find out, who your partners are. If you have multiple, if you have one, we need to test those people as well and treat if needed. And same with genital herpes. That is one where sometimes you'll see the cluster, some sores, and can be painful at times. Sometimes they'll flare up during pregnancy, and that's something you also need to know, and you have to tell your provider about. We can put you on that medication that can calm that down. And also hepatitis B is something that we'd also want to treat before pregnancy too. HPV is something that is becoming more commonly talked about. We now have a vaccine. We've had a vaccine for a while. We can start vaccinating kids ages 11, 12. That particular human papillomavirus puts you at increased risk of cervical cancer and genital warts. Genital warts you can potentially actually see, but the cancer not necessarily. And then another one would also be syphilis, and sometimes this often look like just a single sore. And this one we'd also want to treat early, and that would be treated with antibiotics.
Something important to remember, a lot of women are asymptomatic with sexually transmitted infections, so it's not something that necessarily you're going to know that you have an infection unless you do routine screening. So that's why it's, again, important to see your provider routinely. Gonorrhea and chlamydia can certainly cause chronic inflammation and scarring of your reproductive tract that can impact future fertility and make it more difficult for you to attain a future pregnancy, or increase your risk of a type of pregnancy called an ectopic or tubal pregnancy, which can cause life-threatening bleeding and is not a viable pregnancy. At your new OB appointment, your provider will screen you basically for all of these sexually transmitted infections. One to keep in mind, and you have to tell your provider if you've ever had a history of genital herpes, because that's something that's recurrent and recurs even without exposures. And pregnancy puts you at increased risk of having outbreaks during this time. And you have a high rate of transmission to the baby if you have an outbreak at time of delivery. So that's why it's very important to let your provider know if you have a history of this. We would generally put you on medication in the last month of pregnancy to prevent you from having an outbreak.
Why is it important to space out my pregnancies?
So best pregnancy outcomes have been shown if there's at least a minimum of 1 year in between pregnancies, and for some women 18 months, especially if you've had a previous cesarean. That allows your body to best recover, to have a more healthy pregnancy, and a better pregnancy outcome. Also, emotionally and psychologically, it's really important, to allow spacing of the children. If you're caring for multiple children, very close in age, it can be overwhelming in that aspect. I know a lot of women rely on breastfeeding as a means of birth control, which when it's working, it's effective, but unfortunately, women release an egg or ovulate before your first period, so you don't know when you're going to first ovulate, and subsequently, many women will end up with a pregnancy, while they're breastfeeding without ever having a period. And just to reflect on just how easy it is to become pregnant if you're not protecting or preventing pregnancy, meaning using some type of birth control. The rate of pregnancy per cycle can be as high as 40%, so almost half of women can achieve a pregnancy. And then looking at over a year, 80% of sexually active couples will attain a pregnancy if not using any form of protection. So it really only takes one time, but it definitely is a discussion that you need to have with your healthcare provider, and realize that, we're not trying to prevent you from having a pregnancy, we just want you and your future pregnancy to be as healthy as possible.
Are there any vitamins or medications I should not be taking?
So in general, when looking at medications, if you're attempting pregnancy, number one, you need to be on a prenatal vitamin. I think that's a common misconception on women. They think once they're pregnant, then they need to start the prenatal vitamin, but you've already missed the boat on it. The biggest benefit to the prenatal vitamin is if started prior to conception. There's a type of substance in prenatal vitamins called folic acid that helps reduce risk of birth defects for your baby, and that needs to be started prior to you becoming pregnant. Just a general prenatal vitamin, essentially they're made equally as far as the ingredients that they contain. So any of them are fine to take in pregnancy, but I would be very cautious as far as additional vitamins or supplements, because some of them can actually have poor effects either on you or your pregnancy. Many people think that if it's over the counter or an herbal supplement, that it subsequently won't have bad outcomes, and that's not necessarily always the case. So you need to review all of your medications that you're taking with your provider if you're planning to attempt pregnancy. In general, once you've achieved pregnancy, as far as like general pain relievers, Tylenol is the preferred. You want to avoid things like ibuprofen and Aleve because those do have effects to the pregnancy.